And welcome everyone, and thank you for joining us. I'm Lori Frohwirth, a senior research associate at the Guttmacher Institute. We're a nonprofit based in New York that does research on sexual and reproductive health in the US and internationally. We're best known for surveillance and basic stats on abortion, contraception, and fertility intentions, but we explore more complex questions as well, trying to understand what's behind those numbers. We strive for reproducibility in our work, like everybody else, but also for our own reasons. Working on these topics, which are extremely personal and politically charged, at least in the US, it subjects us to a different level of scrutiny than some other researchers. So not only do we want to adhere to the changing expectations of the larger social science field, we also want to improve our internal processes to avoid mistakes and to make as much of our data as possible available for public use, to demonstrate the integrity of our work and bolster our results. Pardon me. So exploring the more complex questions has also involved expanding our qualitative work, which prompted some questions for us about how to apply these concepts to qualitative inquiry. Sebastian Karcher, Associate Director at the Qualitative Data Repository and Research Assistant Professor of Political Science at Syracuse University, came to Guttmacher and gave a talk about transparency in qualitative work and completely blew our minds. He'll be explaining what this means for you, and my colleague and I will present some case studies about how we've actually implemented this. I'll explain how we're applying these principles to a project for which data cannot be shared. And Jen Mueller, Research Associate at Guttmacher, will tell everyone about her current project, which will be our very first attempt at making an abortion-related qualitative project transparent and publicly accessible. We hope to show you both the why and the how of doing open science in qualitative health research. On to you, Sebastian.
Thank you so much, Lori, and thanks so much to Holly and the QHRN for having us. So first, to give you a sense of where I'm coming to you from, is the Qualitative Data Repository is a relatively young data repository. It was founded in 2014 by political scientists, with the goal of providing a home for qualitative researchers interested in issues of transparency and in sharing their data, where a lot of the infrastructure has really been focused on quantitative data and quantitative research. We're located at Syracuse University in upstate New York, right at the Canadian border. And while we came out of political science, and while we are in the US, we are very international, both in terms of our users and in terms of the data we get deposited. We in fact have data from 5 different continents. We're also increasingly interdisciplinaries. So we define ourselves as social sciences, but we define this very broadly to include anyone who works with human participants. So a lot of education and increasingly actually health sciences, which is one of the reasons we're very excited to be here. QDR is somewhat unique in the US as a repository for qualitative data, but it's by no means unique internationally. And I want to highlight particularly that in the UK data services have been a pioneer in making qualitative data available since the mid-1990s. So transparency, everyone is talking about transparency. You have governments talking about it, you have funders talking about it, you have journals talking about it, right? I have the European Commission on here, I have NHS on here, UKRI, in the US, we have the Center for Open Science, I have the PLOS Journal, RDA actually just has its meeting. That's an international organization focused entirely on making data available. So this is a huge topic. Why do we care about it so much? Transparency has a number of justifications. Perhaps the biggest one is the nature of research itself. What makes science different from other enterprises, perhaps, is that science is a specific set of steps that we follow to gain knowledge. The exact steps vary a lot by the type of science we do and by the underlying assumptions we have. So not all scientists work the same, but what unifies science is that it's a rule-bound exercise, which is why being transparent about how you do your science is so important. Science, in a way, is process visibility dependent. You have to see what's going on for it to be science, for science to be credible. So being transparent as a researcher is foundational to what we do. Being transparent is also just about being a good colleague. It makes it easier for others to scrutinize your work and to build on your work, right? The whole idea of standing on the shoulders of giants or of lots of peers is under that. It's also about being a good citizens. A lot of us are in this because we want to make the world a better place, and open science is more impactful. It invites people outside of scientific institutions into the scientific process. It makes science more impactful and helps us make the world a better place. And finally, a lot of our work is being funded by other people, whether that's governments, citizens through their tax money, philanthropies, and the people who are funding our research are increasingly interested in making it maximally impactful and us being transparent about it and sharing as much of it as can be possibly shared. I want to look at some more of kind of this push towards transparency. So one area where we're seeing more and more of this are journals. The Public Library of Science plus journals have been very early on in promoting an expansive data availability policy. If you want to publish in a PLOS journal, you have to include a data availability statement in which you say where the data that you're using for your article, if any, are available. And if it's not, you have to explain why that's not the case. And as we'll talk about, there are certainly valid reasons. There may not be, but the assumption here is the data are available. And at a minimum, you need to talk about why they're not. Funders increasingly expect data to be open because they're paying for its collection. This is UKRI in the UK. In the US, we have similar endeavors by the National Science Foundation for some time, and the National Institute for Health has just published guidance that is quite sweeping in its demands for data sharing, or at least clear plans for data for all NIH-funded research. There's also, and that's perhaps less obvious, increasingly norms. There is, particularly among younger researchers, I would say, a group of researchers that take data sharing and transparency very seriously and trust research a lot more when they are able to look at data, at processes, at code, whatever is underlying the research. This is from a blog post by a prominent statistician that complains about people not sharing their data, but you'll find different statements, perhaps slightly more gently worded from a lot of scientists. And then academic organizations. So this is from the American Psychological Associations. After research results are published, psychologists do not withhold the data on which their conclusions are based from other competent professionals. And actually, APA is expanding on this. Just today, all APA journals have announced that they are joining an agreement by the Center of Open Science that is referred to as the TOP guidelines. So it's the Transparency and Open Practices Guidelines, which requires that all journals publish data availability statements and strongly encourage authors to work transparently, both about their analyses and about the data. Now, I've talked a lot about transparency, and you may have been wondering, does this really apply to us as qualitative researchers? Can that apply to us as qualitative researchers? And I would say there are a lot of concerns. There is a significant literature on this, but I would say there are perhaps three broad areas of concern. One is this really appropriate? Are we just kind of putting a quantitative template on top of our research that's foundationally different. The second is it ethically responsible and feasible? Are we not putting potentially vulnerable participants at risk by doing this? And the third is, can it practically be done? Is it just too much work, or are there no correct structures? Is this just not doable, even if it would be nice to have? And to look at this a little bit more, I want to start out by making a distinction between transparency and reproducibility. If you listen to debates about transparency in the sciences and social sciences, you'll hear a lot about reproducibility. And that's mainly advanced by quantitative researchers. And what they mean by reproducibility is if you take the data and you take the analysis they ran, typically in the form of statistical codes, you get the exact same results. So you're able to recreate the same tables and figures that they publish in their papers via sometimes referred to as push button reproducibility, right? You click a button in ARS data, SPSS, etc., and get the exact same thing. And to understand how that relates to transparency, I think it's worthwhile stepping back a little bit and thinking a little bit about what transparency actually means in what we do. And based on some work coming out of political science, I find it very useful to think of three different parts of our research that we make transparent. One is the one that I've been talking about the most, which is data access, right? Making your data available for other researchers to look at. But that's not the only part. If I just have the data, I still cannot understand what's going on in your article. The second part is the analysis, right? How did you get from your data to the claims that you are making in your article? And the third component is what we refer to as production transparency. How did you actually produce your data? And that's really quite essential, I would argue, especially for qualitative research, where how we get to our data, our answers, our interviews is a really important component about of what we're doing. Now, in quantitative research, if you have the data and if you have the analysis, which is typically codified in computer code, you automatically have reproducibility. But that's really just a byproduct of having these two products, these two components of transparency checked. And that is not the case for qualitative research, right? If I have the data, and if I know everything that you did in terms of your qualitative data analysis, I'm still not going to get the exact same answers. And I will argue that that's perfectly fine. One way I think about transparency versus reproducibility is in terms of epistemology. So how are we actually thinking about how we're getting to knowledge? And I have this very simplified, I hope there are no philosophers of science here, on kind of a linear line where on the right, all the way on the right is kind of your positivist approach to science, where you're searching for universal laws. And if you want universal laws, that does mean every time you do the same thing has to happen. A lot of what we do as qualitative researchers isn't really that. We are interested in understanding and taking the participant's point of view in those sorts of things. And that also happens on a broad spectrum, right? This takes up a large chunk of my line here. But I would argue a lot of what we do happens there. But while we won't get exactly the same results, I can still show you, here is what I heard, and here are the conclusions, the interpretations that I'm making based on what I heard. And that's transparency. It's not reproducibility. Lori is going to interpret an interview slightly different. She may also get slightly different answers in the same interview, but I can read the interview that Lori did and read her analysis and say, okay, I understand how you got to that interpretation. That's transparency. I shall note that there is a a strand that believes that it's very hard, if not impossible, to get to intersubjective understandings of meaning between different researchers. And if you're really strongly committed to that, it's really hard to make the case for transparency. But I would argue that's comparatively rare in qualitative research. But if you believe that, this may not be for you, and that's okay too. There is another angle I like to look at this with. If you are working in a somewhat more neo-positivist type of framework, qualitative research may play a role in earlier stages of the research. So if you're doing hypothesis generation, theory building, measurement, as you'll actually hear from Jen, qualitative research plays a really important role, but it plays a role at a part of the research that's not necessarily designed to be reproducible, right? If you're refining measurement, you're not trying to do the same thing over and over again. You're trying to better understand how measurement works, to then perhaps later do reproducible and replicable science. And so there again, our qualitative research should be transparent, because we still want to understand, how did you run your studies that refined the measurement? That's really important, so that you get good measurements. And then if you later want to do reproducible, say quantitative research, it works. But in itself, it needn't be reproducible. Ethics is a huge topic. And it's a big topic in quantitative human participant research too. It's a bigger topic in qualitative human participants research, not least because we work so closely with our participants. One part of being ethical about transparent research and data sharing is the consent process. We want to ask participants about transparency and data sharing, and Jen will talk about how they did that in their research. We shouldn't just confront them with it. We shouldn't just assume they're okay with their data being shared. We should ask them about, can I share your data? Very often we want to worry about their privacy and confidentiality, and especially as we're working on sensitive topics. So we'll look at de-identifying, removing identifiers from the data. Often that's possible, sometimes it's not possible. And in that case, we move on to the third step, which is either we do not make the data available at all. That's going to be Lori's case. Or we put access controls on data to make sure only people who will treat the data carefully and with the appropriate safeguards have access to the data. Note that even if you don't share data, you can still be transparent about the production of those data and the analytic processes you used to analyze it, which is what Lori will talk about now.
Great. Sebastian, thank you so much for walking us through the concept of transparency in qualitative research, for showing us how it's both appropriate and ethical for us to do our work in this way, and explaining a little bit about what's needed for data access. I wanted to share something that we've been working on that addresses the feasibility of making our data production and analysis transparent and potentially accessible, right? Like, how do you actually do this? So we developed a checklist to help researchers build what we're calling a transparency archive. The goals of this are to help us follow the principles of transparency that Sebastian has laid out throughout the life cycles of our projects, so that we could potentially share our data, to help us generate transparency related materials as we go, to document these activities for our own future work, and to help us distinguish between what's useful for internal documentation versus what's necessary to include in a public repository, because that stuff would be useful to outsiders seeking to understand the project. Next slide, please. So our checklist is basically a list of materials categorized by what stage of the project they refer to, and indicating whether they're meant as useful just for that internal documentation or important to include in the package of materials that you present in a public-facing forum. The items on the checklist were gathered from QDR's resources, from qualitative reporting checklists such as Correct, and from our own experiences and expertise. We have about 30 items on there right now, which may sound like a lot, but the vast majority of them are things that you would have anyway, such as your final IRB or ethics board materials, an overview of your methods of data collection, your node structure. This tool, the checklist, will remind you to do this necessary documentation. It'll help you determine whether these items could or should be shared. And by grouping them together, it encourages you to see this documentation as a way to make your work transparent, that is, comprehensible and defensible. There are also some items on the checklist that you might not be as familiar with, and still others that are going to be dependent on processes such as consenting for data sharing if you choose to do so. Next slide, please. So the project I've been working on for the last few years is a longitudinal analysis of people's experiences getting sexual and reproductive health care in a US state that restricts how these services are paid for. So we've been looking at how people navigate barriers to this kind of care and what impacts those barriers have on them, particularly on their contraceptive strategies. It's a lot of data. We have 40 respondents and 3 waves of in-depth interviews. There are a ton of analytic products apart from the interview transcripts themselves. We've got structured memos for each respondent for each wave, plus a memo of each respondent's trajectory over time. We've got point-in-time summaries of themes, plus matrices at both the respondent and summary level. Now, one of our partners in this project was not comfortable with the idea of us making these data available for public use. It's disappointing, but it's understandable. So does that mean that it's not worth it to try to do this project transparently? Next slide, please. We judged that it was both possible and beneficial to strive for production and analytic transparency, even though our data would not be publicly accessible. And we used the transparency checklist to help us do that. We created all the items on the list that were applicable to our project, and I'll go over a few that were crucial to attaining these kinds of transparency in our processes. So to achieve production transparency, or to fully describe how our data were collected, we created a detailed data management plan. QDR offers some templates for creating these, which include documentation of personnel, practices and procedures, formats, volume, storage, and organization and presentation of data. Now, although we've done scores of qualitative projects at Guttmacher over the years, we had never made a formal data management plan before this. So using the checklist prompted us to do so for this project, and I am beyond thankful that we put thought into these structures and procedures at the outset, and that we had a dedicated place to document the many, many changes we made as we went along. Our analytic transparency is guided by another item, that's our analysis plan. This documents our research questions, our approach and theory, our plan for coding, matrix construction, and basic analysis. It also provides a narrative of the evolution of changes in all these areas. Again, formally writing this out was a first for us, and again, it proved crucial, especially, for example, when we had a long and contentious meeting about which respondents to include in our final data set, because not everyone completed all 3 waves of data collection. And then we nearly forgot everything we decided because the decisions hadn't been documented in a central location. So now they are. These documents are now stored in our internal transparency archive, along with copies of all the data and analytic products that I mentioned before. The archive also includes a statement about data access in which we articulate why we can't make them publicly accessible. Our data use agreement forbids it. So the checklist serves as a table of contents and a guide to this archive. Ours includes links to the location of all of these items on our internal drive. Next slide, please. Now, of course, none of these items are magical and new, and many of them are ones that you're probably already producing within the course of your work. The checklist and the resultant archive have been rather magical for us, though. They've forced us to document decisions that tend to get lost in the shuffle and to think more critically about the decisions that we do make. They've improved our project organization and workflows, and they've introduced us to items that were not previously a part of our qualitative practice. And when complete, the archive helps us in doing our work as transparently as possible. We found it to be absolutely worth it. Jen?
Thanks so much, Lori. So now I'll bring together some of these concepts we've been talking about and talk about a qualitative project that we're using as a demonstration for data sharing and transparency. Next. So as part of a large National Institutes of Health funded project investigating the quality and completeness of women's abortion reporting, we conducted cognitive interviews to test and refine survey question wording in 2 US states. We've been working with QDR to understand the process for potentially sharing the study materials and data on their repository at the end of the study. While NIH is funding the larger study and data collection effort, we're utilizing a different funding source for the work that we're doing to advance reproducibility and transparency of our research. Next. So as Lori described, a transparency plan is a useful tool to ensure that a project is following the principles of transparency. So we modified the tool Lori developed to use as a checklist for our own project. The tool has helped us to plan materials we need to develop for the project, as well as ensure we're documenting the processes effectively. It's also functioned as a resource for documenting decisions regarding what materials we might share from the project. So when reviewing the transparency checklist, we gave special consideration to the sensitivity of our data and how that sensitivity impacts what we feel comfortable sharing. Because our interviews include people who have had abortions, we're still determining if we will share the final de-identified transcripts, even though they're not focused on respondents' abortion stories. This is because we want to be extra cautious in protecting respondents due to the sensitivity of abortion and concerns about potential for re-identification from seemingly de-identified materials. So we made some slight modifications to the tool in order to tailor it to our project needs. Since the project is ongoing and we have not yet decided if some items will be shared, we have included a recommended for sharing column to indicate items that we should consider sharing. In addition, we added a column to track the status of each document. In the notes column, we're including reasoning for why certain documents may not be shared, as well as remaining tasks needed in order to finalize items. Additionally, we created a data management plan for the project where we summarized decisions for collecting, storing, and securing data. We adapted the checklist assembled by QDR, which outlines issues that should be addressed in a data management plan, such as practices and procedures used to organize data and keep it safe, the documentation that will be generated, and plans for sharing the data. In addition to keeping the processes transparent, the data management plan helps us to think through how to prepare the data for being publicly shared. For example, by mapping out the various pieces of data that would be collected, we're able to pinpoint the places where we could avoid collecting, identifying information, thereby protecting participants and making it easier to potentially share the data publicly. In our study, we used a burner email and phone to recruit participants for our pilot interviews and didn't save their contact information. For the main interviews, the recruitment firm had the participants' contact information and we never had access to it. At the start of each interview, we assigned participant IDs with no link to the participant's contact information. And additionally, we use verbal consent, so participants did not have to sign their name on consent forms. However, a participant may have mentioned something that could be identifying in the interview, such as their partner's job, their child's name, or something that on the surface might not seem identifying, but could be. When we clean the transcripts, we look for this information and redact any that we find. Additionally, when we coded the data, we flagged anything that was still remaining that could potentially be identifying and redacted it then. Another concern when thinking about sharing our data is around the sensitivity of abortion data. So again, the content of our interview centers on the participants' feedback on survey questions and not on their in-depth abortion story, so there's less potentially identifying information revealed. Although we didn't ask them explicitly during the interviews, some participants still provided details about their abortion experiences, referencing their friends and family or abortion access in their community. For all interviews, it's critical to think about how much of the story would need to be redacted or if demographic characteristics associated with the transcript can make it possible to identify someone. We're still determining whether our de-identified transcripts can be shared. For the data that we will share with QDR's repository, we've come up with some access controls that QDR will implement to allow other researchers to access the data. For those who want to access the data, QDR will review their institutional affiliation, research plan, data management and security plan, and commitment to destroy the data when done with it before granting access. So in the US, institutional review boards, or IRBs, are responsible for reviewing and approving research to protect the rights of human participants. For our study, we needed to describe to both our IRB and potential participants that their data might be shared with external researchers. In our IRB protocol, we explained in the informed consent section that we'll ask participants if they consent to allowing their data to be shared for future research purposes, and that this consent is optional. There was a separate consent for participation in the study. So we included in the consent form, if you agree, the transcript of your interview may be shared with researchers at other organizations in the future. We will take out or change any information that could identify you before sharing. You can be in the study whether you agree to data sharing or not. In the procedures to protect confidentiality section, we laid out the process for sharing data with QDR and implications for confidentiality. So we included information on how the data will be de-identified in order to make it fit for sharing publicly, how QDR handles sensitive data, that other researchers would apply for access to the data using a special deposit agreement, and that Guttmacher would set application standards that would allow access to the data. Again, thinking about the language that we included in the consent form, we tried to make this understandable at an 8th grade reading level. And we had participants mark their choice regarding data sharing and included their participant ID so we could keep track of who agreed or not. And so because we're interested in how participants understand data sharing and how they decide whether to participate in data sharing, we followed up with participants at the end of each interview, asking them to reflect on the experience. In particular, we asked a couple of questions to get feedback on how the participant understood data sharing. We asked them to explain what they thought data sharing was and how they made their decision to share or not. What we found is that the vast majority of participants agreed to potential data sharing. Respondents from both states, with and without a history of abortion, did not consent to data sharing. So in general, participants who agreed to data sharing felt comfortable doing so as long as their name or other identifying information was not included, and some were motivated to share because it might help someone. So this participant said, when you said that my name wouldn't be attached to it, that made me more comfortable sharing my data, if that's gonna, help people understand more about abortions, why people do it, and stuff like that. I would be happy to share. I would say even if my name was attached, I would maybe still share it if it were to help. But the fact that it's not attached made it easier to be like, okay, yeah, to say yes. So those who did not agree were often concerned about the overall privacy and confidentiality of their responses. So this respondent said, I'm in the middle of wanting to share it and not wanting to share it. And I just don't, I don't know how the data is going to be used. And I just probably wouldn't want, in the long-term scenario, having it come back at me. Respondents also described what they understood data sharing to mean. Some respondents could accurately or somewhat accurately describe the general concept. So this respondent said that other people may be interested in the survey process that you guys did and could be helpful to them. So that's what I got from it, that it would be shared to other research people that need answers to the questions that maybe they didn't do, but they would like the data, I guess, from it. However, some participants did not seem to have a very clear understanding, interpreting data sharing as participating in research or disseminating findings, despite our attempts to explain this during the consent process. So this respondent said, when you mention the word data sharing, it could be an article with different points of view, no names, no nothing, but different points of view of the people that you've interviewed. So that's what I thought about it. A magazine, a book, or what do you call those things they give you sometimes? A pamphlet, I think it's called. Something like that with opinions of women. So we're currently systematically analyzing these responses and writing up the findings in order to highlight how we could better explain this process to research participants. We're leaning towards not sharing the transcripts of respondents who did not have an accurate understanding of data sharing. So based on our experiences with our demonstration project so far, we have a few recommendations for others who may be embarking on a qualitative project and who wish to do so in accordance with the principles of transparency. So it's important to think about how to make qualitative research more transparent and able to be shared as early in the study process as possible. Before you collect data, before you create your study tools. Creating early drafts of data management and transparency plans will also help highlight what adjustments you'll need to make ahead of time. Work with your ethics review committee to make sure they understand what you want to do with the data and how the data will be shared. They can help you come up with the appropriate language for participant-facing materials and ensure respondents are protected. Lastly, conduct mock and pilot interviews to gather feedback on how study participants may interpret your data sharing question and how you could describe the data collection process more clearly so they know what they're consenting to. And then we've just included a list of some of the resources that we mentioned during the presentation. And yeah, I hope that this was helpful to anyone working with qualitative data and thinking about how to make their research process more transparent. So thanks so much for listening, and we look forward to hearing your questions.
A huge thank you to all of you for presenting such an important and interesting seminar on data sharing and qualitative research. So we've got quite a lot of discussion going on in the chat, which we'll go to in the questions, if that's okay. Somebody has said that slide that we can find resources, can we see it somewhere again? So I don't know if we just want to pop it up for a few more minutes again so that people can have a look. But just to say that the seminar is also being recorded, so you'll be able to access these slides.
And I think we'll share the slides themselves too.
Oh, that's brilliant. Thank you so much, Sebastian. So if you just send those to us and we can circulate them to the participants. So we've got a question which says, can people use your data in the same ways we can use quantitative data that is available online? So I don't know if you want to answer that.
I can maybe start. So as you heard, the data from Lori's study, no. The data from Jen's study, it depends on the quantitative data, right? Some quantitative data is what's referred to as public use or open access data. So you can just go download the data, immediately use it. There are some qualitative data for which that is the case, but that's fairly rare. We typically don't think that data qualitative data such as interviews should be quite as openly available and potentially end up somewhere on the internet. And with more sensitive data, such as abortion data, that's even more so the case. So in this case, you'll have to individually, and Jen, I think, ran through the process, but you'll have to individually request access to the data. We'll check that who you are who you say you are, and you'll have to submit some documentation that shows that you have reasonable interest in the data and plans to treat it ethically and responsibly, including storing it safely and destroying it once you're done. Mm-hmm. Your local copy, obviously not all the data.
Thank you, Sebastian. And do Jen or Lori have any extra thoughts on that one?
I would just say that at Guttmacher, we do make our quantitative abortion surveillance and survey data publicly available, also through a repository with some access controls, but just to say that they are not sort of politically motivated access controls, and that as long as somebody presents a valid affiliation research question and data management plan, they are granted access even if they are from an anti-abortion organization, for instance.
Mm-hmm, mm-hmm. Thank you so much. And so we've got quite a bit of discussion in the chat about the level of de-identification, I guess, if that's an accurate summary. So some people are kind of saying that they feel uneasy about the idea of sharing transcripts. And there's a question here about whether it's ethical and in line with GDPR to share transcripts, even if anonymized, as participants could potentially be identified through the sensitive nature of their accounts. So I just wondered if you had any thoughts on that.
Jen, do you want to start on this?
Sure. Yeah, so I mean, I think as, you know, I've tried to lay out, like, we have been, you know, going through our transcripts, you know, at various stages and finding things that could potentially, you know, be identifying, and it's kind of, you know, weighing, you know, in all these different situations, like things that might, you know, end up being identifying, even if they don't seem so, you know, obviously. But I think that, you know, I think we on our team, I think agree that we're, you know, it's it really just depends on the content of the interview and how specific of a individual's story it is. So in our project, people are, it's a cognitive interview. So folks are responding to, giving their interpretation of what a question means, right? And so in response to that question, they could be giving a ton of details about themselves, or they could just, be describing how they're understanding the question. So I think, at least for our project, we're really just trying to flag how much is truly identifying about that person and their specific story, but a lot of it isn't really about their specific story in our case. So we're still kind of weighing that, but yeah.
I just say
in terms of GDPR specifically, 2 points. One is that GDPR, of course, is big on permissions and consent. And so for GDPR purposes, the being explicit about the reuse of the data while you collect this is absolutely crucial. And once you've got the consent for reuse, and there are specific research data stipulations in GDPR, we feel that it's clearly covered by GDPR to share the data in line with the consent given by the participants. Anonymization in GDPR is a huge and quite controversial topic that I'm not enough of a lawyer to speak to, in particular because it's significantly stricter than the respective categories that we use in the US for de-identification. So I'd rather not go into great detail about what anonymization means for GDPR. But even with that bracketed, the consent is really a crucial element of GDPR.
No, that's brilliant. Thank you. And I've just seen that we've got a hand up from Georgia. So I don't know if Georgia just wanted to ask a question before we move on to the rest of the chat.
Oh, yeah, please. Well, it was sort of further to the same point, which is I wonder if any of you has a view on whether there's a sort of ethical or moral imperative to make your data really available, like as in anyone in the world can just click on an internet page and get to it, whether we're talking about transcripts or coding or data management, any of those things. Or what we've done a lot in the past is get consent from the participants that we might use the data in another research project, or that another researcher might use it, and that they would have to go through another ethics process and apply to us to use the data. So it's still sort of, it's got that kind of feeling that we're taking good care of it in a lovely cupboard somewhere, but it's not kind of out there in the world. But we still feel that's a good compromise for transparency and particularly the sort of utility of the data, that people get to use it. And it's not quite the same thing as transparency. Anyway, I'm sorry, that was a stream of consciousness, but I just wondered if you had views on whether it's really necessary to put it just completely openly on the internet, or whether sort of on application, by application is good enough.
Thank you, Georgia. And any thoughts?
Well, that stumped them.
Yeah. Lori, Jen?
I think that this whole process for us, as it's the first time we're entering into it, has been kind of a grappling with those questions. Again, seeing as how we have at least some form of access controls, even on our, what we see as completely de-identified, although that's contentious quantitative data. I don't think that we see it as an ethical imperative to have a click and download our transcripts from qualitative interviews. I think that we see this as a striving process of, making as much publicly available as possible. And, I think I saw briefly, it popped up in the chat, the idea of separating transparency in processes from data access. And this is something that we're taking to heart a lot. As I said, my data was just not, my data as in the full transcripts are not going to be available in any kind of public repository, but I am hoping to have my materials in a repository at QDR that are just not the full transcripts. So I do have to think about de-identification and which materials to what level could be included in that archive, and then what the access controls might be. And so it doesn't feel to me like a sidestepping of an ethical obligation. It feels like a way to be responsible both to my research partners and to my participants, taking care of the data while also serving the scientific community.
Yeah, the EU has this very useful phrase that they put in all their data publications, that data should be as open as possible and as closed as necessary. And I think that's a very good way to think about it. We have a strong relationship to our responsibility to our participants, and we as a data repository extend that to the participants of people who deposit data with us. And I rarely think that qualitative interview data should be open data in the strict click and download sense. We have an almost blanket policy, in fact, against putting truly open licenses on interview data. There are some qualitative data where that's fine, right? In archival data from the 19th century is an example where I think making it truly open is absolutely no problem. But interview data, I think, rarely should be. Sometimes you can make it relatively easy to access. If it's low-risk data that's cleanly de-identified, I'm fine with just someone accepting conditions of use. If it's higher risk data with more details, less certainty that it's cleanly de-identified, additional safeguards are warranted. And I think that's exactly, for example, also how UKDA in the UK handles access to qualitative data. Very, very little is truly open. A good chunk, you just register, can access it. Anything that's sensitive in a more meaningful way requires additional processes of access.
Thank you so much. And if I can now shift the conversation slightly to consent. So we've had a few questions about how long consent applies for. So we've got one question that is, how is ongoing consent applied, i.e. if individual participants decide to withdraw consent? And we've got a related question that says, how long is the agreed consent for? And how or who do people contact to withdraw from consent? So any thoughts on that one?
It's a little tricky so three things. In practical terms, the data are on the data repository, so they'd have to contact us. Number two is the data are de-identified. So we will, as you heard, not even Jen and Lori know the identities of their participants, and certainly I don't. As a repository manager. So it's a little tricky, and that's the same issue with quantitative data, right? Getting your data taken out of a survey when something has been published is actually quite tricky. As a practical matter, if someone came to us, we would do our best to take the data down, but having talked to lots of repositories, that's exceedingly rare. So the withdrawal from consent typically, when it happens, and even in ongoing research is relatively rare, happens during the conversation or shortly after the conversation, where that's easy to manage. And it's very rare that this was happen, 12 months, 20 months after the research has concluded. But if it were to happen, they would contact us, and we would take it down as an ethical, probably rather than a legal question.
Mm-hmm, mm-hmm. Thank you, Sebastian.
And Jen, I don't know if your materials specifically address withdrawing consent once it's been given. And again, this is the first time that we have entered into consent for data sharing. However, as a practice of our interviewing, we are always providing our participants with our personal contact information. It's also, pretty Googleable. So they have that information with them when departing from an interview, or emailed over Zoom interviews, as we've been doing more recently. So we try to establish really rigorously that we are open to being contacted for any reason after the interview is complete. And so if we were to ever receive withdrawal of consent from data sharing or even participation, it would be fairly easy if the person still had their ID number for us to withdraw an individual transcript from an archive.
Thank you.
Yeah, I was just going to say, the only thing I would add is that in our interviews, I mean, we introduced this concept, of this opt-in in the, consent process, right? Then we went through the entire interview, and then we asked those questions about how they understood data sharing at the end. So like at that time, they could change their mind at that point as well, in addition to what Lori and Sebastian have raised.
Brilliant. So we've got a couple more points that I would like to just get through before we finish, if we can. So there's a question about resources. So there's a couple of questions. I'd be interested to hear how much additional work and time you've found doing your studies according to the transparency framework, and also what are the transaction costs of setting up these systems, what additional resources are needed in terms of time, etc. So if you have any thoughts on that.
I would say it's a little bit hard for us to separate this because this is embedded within a larger reproducibility initiative that is funded at our institute. But I would say, yeah, it takes hours more, to truly do this documentation. And I would say that padding your, each stage of your project, by at least 15 hours to create some of these materials is reasonable. However, I, even without the funding, would not go back. I have been, doing this work for a long time, and often I'm looking back to previous projects and just throwing up my hands and saying, I couldn't even tell myself what I did 10 years ago on this project. And that's not a good feeling. I would scrimp in order to try to complete this checklist, if at all possible.
Thank you so much. And we've got an interesting point here where somebody has asked for some discussion on data analytical notes in multiple languages for multi-site projects from the context of transparency. So I don't know if you had any thoughts on that topic that you wanted to share.
So I would say we have data in 10 languages or so on QDR. We generally think that translating too much stuff is a waste of researchers' scarce resources. That's even more the case now that automated translation for someone who just needs a quick overview of something and doesn't happen to be an area expertise is typically sufficient. So we generally publish in whatever language the researcher has their data. I don't know if Anne is on the call. She works a lot international. That's Anne Moore, also of Guttmacher. If she wants to chime in.
I just would underscore what you said, Sebastian, that if you are trying to make your data transparent, it's not probably in your budget to be able to translate everything. So you just have to retain the language in which the data were collected and the resources in the language in which you applied them. And that will inhibit access for some people, but it is true to the way your process worked and adequate for retaining transparency.
Brilliant, thank you so much. And we've got two more questions that I would love to cover if we can, just so that we can say that we've done as many as we can possibly do in the time. So do you think that the extent of transparency could change according to the political situation of the country where data are gathered? Don't know who wants to answer that one first.
Yeah, as a political scientist, I think about this a lot, and the answer is absolutely yes. We think a lot about political context, and it's a little bit tricky because that can change, of course. And the paradigmatic example for that is the Arab Spring. If you talk to participants on Tahrir Square in Egypt in the middle of the Arab Spring, they were often very willing to tell you lots of things and put their names on it and everything. And that would have been a bad idea had researchers made that public. Now, Middle East researchers were aware of the volatile situation, and I think anything happened to research participants there. But it's a real challenge, right? Not just that take conditions into account, which you can do, but also to take the potential for changing conditions into account.
Thank you very much. And the last question, I think, although if anyone has got a question that I haven't asked, then please do pop it in again, just so I can see it. Do you foresee that there might be a requirement to check repositories for available data sets before collecting primary data during the IRB or ethical review process? So I think this is asking whether people should be looking if a study has already been done or the data's already been collected before collecting new data.
I don't know. What do you think, Lori, Jen?
Well, I mean, I'm another project I'm working on right now is a secondary analysis of data that's not publicly available, but that's ours, that we collected previously. And it was sort of hard enough to convince our colleagues and our own IRB to allow us to even do this. So I would say, although that's really intriguing, I don't see such a requirement happening because of a bias against secondary analysis. But and also the fact that your sample selection, your approach to creating your interview guide would have to be so completely aligned with, and other things would have to be so completely aligned with that data that was publicly available in order to be appropriate for your new research question, that I would see it being kind of difficult to find a fit, but maybe a pooled analysis where you could talk to fewer people, go to less places, if there was something similar available on a repository, could be an interesting, if not requirement, then suggestion.
I mean, what I think my hope would be that it becomes more like a part of your literature review, right? That it's an expectation to cite the relevant literature and to have reviewed the relevant existing data. But I really hope that data sharing doesn't become a reason to do less primary research. And my impression is that that's not a real risk in qualitative work.
That's brilliant. Thank you so much. And then we've just had a comment literally that says, makes assumption that we're talking about interviews, but other qualitative data might be more relevant, e.g. photos, videos, etc. So that's just something to consider, I guess, within this whole discussion. So we are out of time now. It's exactly 4 o'clock. So I just wanted to say a huge, huge thank you to our speakers. It's been a fascinating discussion, and I think everybody will agree that this is something that we need more discussions about in qualitative research in terms of open science and how we do it in a safe and helpful way, but also making sure that all of the ethical considerations that you've mentioned today are really key and at the forefront. So a huge thank you, all of you, for helping us to think about this. So as I said before, the recording will be available on our website. And yeah, a huge thank you again to our speakers. It's unfortunate that we can't give you claps like we can in face-to-face situation, but everybody's in the chat thanking you, so please do have a read of that before you leave today. So thank you, everybody, and I'm very happy to now end the seminar after a very fruitful discussion. So thank you all.
Thanks so much for having us again.